Hello, everyone. A very good evening to you all. Myself, Dr. Sumedha Gupta, and on behalf of Voice of Healthcare, I would like to welcome all the viewers who have joined us today. So, today we are here for an insightful session on the topic Heroes Fight for Health. Join the prostate cancer awareness. And I would like to mention that this initiative is supported by Zydus Life. So, as of the latest data, prostate cancer is one of the most common cancers among men in India. According to the World Health Organization, prostate cancer accounts for approximately 11.6% of new cancer cases in Indian men, reflecting a significant increase in incidence over recent years. The estimated numbers of new cases is around 60,000 annually, which is a notable rise in diagnosis, which actually is due to improved awareness and screening practices. However, despite advancements in detection, the mortality rate remains a concern, emphasizing the need for enhanced care, public health strategies, and early intervention measures. And in the light of these stats and facts, in this session, we are going to discuss about the holistic prostate cancer by integrating physical, emotional, and psychological support. To begin with the discussion first, I would like you all to please join me in welcoming our experts who are going to provide us with insightful information on this topic, understanding about the prostate cancer care and its awareness. So I would like to welcome Dr. Pradeep Garg, Associate Professor and Head Department of Radiation Oncology, GGSMCH, Faridkot, Punjab. Good evening, Dr. Pradeep. Welcome to the panel discussion.
Thank you. Thank you, Dr. Sumedha.
Moving ahead, I would like to welcome Dr. Arun, Consultant Medical Oncologist, Capital Hospital. Good evening, Dr. Arun. Welcome to the panel discussion.
Good evening, ma'am. Thank you so much for inviting me.
Moving ahead, I would like to welcome Dr. Jatinder Arora, Consultant Medical Oncologist, Patel Hospital. Good evening, Doctor. Welcome to the panel discussion.
Thank you, ma'am.
Moving ahead, I would like to welcome Dr. Gurwinder, Consultant Medical Oncologist, AOI Ludhiana. Good evening, Doctor. Welcome to the panel discussion. Moving ahead, I would like to welcome Dr. K. Madan Gopal, Advisor and Head, Public Health Administration, National Health System Resource Center, Government of India. I would like to mention that Dr. K. Madan Gopal is going to join us shortly. So, before delving into the discussion, I would like to mention that this is a 60-minute panel discussion. So, I would request you all to please highlight and provide us with all the brief insights for all the pointers that we are going to discuss. So, let's delve into the discussion. So, Dr. Pradeep Garg, I would request you to please discuss us about that what constitutes a holistic approach to prostate cancer care and how does this differ from conventional treatment methodologies?
See, first of all, we must acknowledge that prostate cancer is a disease of old age group. Geriatric oncology का एक part है prostate cancer. So when I started my DNB or the post graduation in radiation oncology, at that time we were having limited approaches for the prostate cancer. The era was of evidence-based medicine. Over the years, now we have moved to the patient-centered care, that the tailor-based medicine, that how to improve the patient's health on the priority basis. So, in a holistic approach to prostate cancer, I think it encompasses all the patient's well-being, integrating physical, emotional, then social well-being, spiritual aspects, and the management of disease as well. So, main components will be the patient-centered care, that you have to treat the patient as per his requirements or his agony about the disease. And now it is a multidisciplinary teamwork. Cancer prostate is the comprehensive cancer care network is there. Like we need oncologist, we need nutritionist, psychologist, then the physical therapist, then the physiotherapist to rehabilitate the patient into the normal life. Then the lifestyle modification which we need to have over the years. Complementary therapies may help in the patient like yoga, meditation, acupuncture, herbal supplements that may also improve. It is different from the conventional treatment because conventional treatment was the disease focused. Now we are more toward the patient centered approaches, and the standard protocols are still being followed, but in a teamwork. So the better care is possible right now as compared to the past eras.
Thank you, Dr. Pradeep. And I'm sure that holistic approach truly adds depth to the patient care by addressing all the aspects of well-being and not just the disease. And I think these insights on integrating these elements are totally valuable. I would like to welcome Dr. K. Madan Gopal. Good evening, Dr. K. Madan Gopal. Can you hear me?
Yes, yes. Good evening. Good evening. I'm
I would
connecting with my
request.
computer.
Yeah. Sure. Moving ahead to Dr. Arun, I would like to discuss that in what ways can we integrate physical, emotional, and psychological support to enhance overall patient outcome in the management of prostate cancer.
So once the patient comes to our OPD, what is our aim of treatment? Aim of treatment is to just make sure that the patient is at ease, to ease the burden of the disease, to look into wholesome part, not only the disease as a person, as a what is a what to say, as a family member, you have to just invite them and make them to sit down and discuss with that in order to contribute better to cope up with the disease itself and the treatment itself. Okay. So, as per the psychological analysis, the men with prostate cancer shows depressive symptom in the initial 6 months of diagnosis. The partner is more concerned. They show disease from the day one itself. It's a UK study. So, how do I address the concern? So, I emphasize with them. So, we motivate them to find a solution together. So, what are the emotional aspect I need to focus on? We know that uh, CA prostate men, according to Australian data, they are risk of suicide for 70%. So the emotional aspect we look into two parts. One part is the cancer specific distress. Another thing is this decision related distress. So what we have to look into it, whether the patient had depressive symptoms or not. Even 20% of the patient will have depressive symptom before diagnosis. The anxiety levels are so high. So the cancer itself is shock for them. So to ease the how to say emotional burden and the bring to the anxiety levels to a lower level, so we have to discuss about the decision making. Even the decision related distress is quite high. It is 63% noted in UK. They told that in every first visit to the hospital, all the patients of CA prostate express some kind of decision related distress. So it may be a physical means some kind of what to say urinary symptoms, or so depressive state, lower sexual drive, or urinary incontinence. So these are the emotional things and psychological aspects I have to look into it. What about the physical aspect, whether the patient is good enough to take on the therapy, or she having any, see, in metastatic disease, bone related symptoms will be high. So any skeletal related events are there, any urinary tract obstruction is there. I have to look into the physical part as a physical examination. Emotionally, I have to look into it, how they are fit enough to digest the diagnosis of cancer. Okay. So emotionally, the family partner, and we have to bring them to our level to understand this is the disease. We have to educate that. So what we are trying to make a change, how we can help you. So the fighting solution together makes many things easy. So I find that integrating physical, emotional, and psychology aspect, so to certain extent, so it makes them to cope up with the disease, and the compliance will be better. The family members will be happy. The partner stress will be less. So you have to tell that the prostate itself will not going to kill the patient. The symptoms and another parallel aspect, the diet and the mental distress, that's going to that's going to kill the patient daily basis. So it's not about the therapy, it's about the person who we are sitting in front of them and dealing with them. So all the three aspects, the emotional, physical, and psychological aspect, will focus on the aim, will focus on the person wholesome, and it brings us to bring back the patient to us in a good way. So he's motivated, he's committed, his effort is absolute. So these are the things I look into in my practice. So basically, the two things, the aim is only to cope up with the disease, cope up with the treatment. So I just speak a lot and educate them. So the compliance is better. The patient at his family members are looking the bad things in a good way. That's how I do things.
Well,
Thank you
thank
so
you,
much.
Dr. Arun, and your emphasis on combining all of the physical, emotional, and psychological support highlights that how comprehensive care can easily transform the patient's outcome. Moving ahead to Dr. Jatinder, I would like you to discuss us with what are the specific physical therapies or interventions have shown efficacy in complementing standard prostate cancer treatments.
As Dr. Arun has discussed about the brief things that everything is important for the prostate cancer management. But yes, exercise is one of the important component. Exercise prevent the recurrence as well as the prevention of the aggressive prostate cancer. What the research analysis has been seen that by 86% they reduce the chances of the aggressive prostate cancer if the patient walk 2 to 3 hours per week, especially in the cases. And the exercise can be of any type, like bicycling, running, jogging, swimming. So the individual which they can apply by their own method, but we should encourage them that they should go for the regular physical activity. Second, they have what they have seen that even the patient who have the regular exercise, they have the reduced anxiety also. The level of the recurrence and the other emotional factor also reduced by doing the physical activities of the patient. And as well as the urinary incontinence problem after the radiation or the surgery, if we train them out the Kegel exercise, that is also one of the basic important part where they can get encouraged that the symptoms can be reduced, their anxiety can be reduced, their sexual dysfunction, and as well as the urinary incontinence problem can be solved. So the physical aspect is very important part of the prostate cancer management among the patient who are on the treatment as well as the for the prostate cancer survivors.
Well, thank you, Dr. Jitendra. I think the physical therapies you mentioned are crucial for enhancing patient comfort and recovery, and the focus on these complementary treatments is impressive and very relevant for the patient for in their treatment journey. Moving ahead to Dr. Madan Gopal, can you please tell us how can policy changes improve access to holistic prostate cancer care that integrates physical, emotional, and psychological support for the patients?
Okay, thank you, Sumedha. There was some technical glitch. I joined with a different link and I could not connect. Thanks for getting me back on the right link. Okay, thank you. This is one of the important questions as I was listening to the other speakers. So, from the policies perspective, we do have some activities in place, policies in place, which talks about screening of cancers. But right now, because of the volume and the other things, because we are talking about 1.4 billion population, it would be 1.5 billion population, and 60 plus population is around 13% of this population. So we are talking about this problem because essentially prostate and prostate related problems do occur after in the sixth decade. Now the time is also shifting. 55 plus also people are being reported to have prostate related problems. That's one thing. The policy is conscious about that, and recently in the senior care, the position paper which has been released by Niti Aayog, it talks about having a holistic care for the seniors. It's not only detection; it talks about the mental well-being of these people also. If you look at the structure, the health structure which has evolved, basically previously it was all rural focused. As a result, we have created a lot of rural infrastructure. From for the last one decade, that is 2013 onwards, the focus has been on the urban areas also. So slowly and slowly, the policy level things, it has improved the infrastructure aspect. So if you look at the structure of the health in the country, right up to a population of 3,000 to 5,000, it's not on paper. You can go visit and see. Because the moment I say, people will say that it's only on paper. Government, no, it's there and structure is there. And during the COVID times, the resilience of the public health infrastructure was well established. Single day we could do 2.5 crore vaccination, which is not possible without having a structure in place. That's one thing. That's one caveat which I'm saying. Otherwise, people will be tempted to say it's only on papers. No, you can go and visit. Since 1978, the structure has been, norms have been laid down. Norms have been laid down that structure would be there at 3,000 cater to a population of 3,000 in tribal and hilly areas, and at a population of 5,000 in normal areas. Now they are called as Ayushman Arogya Mandirs, wherein comprehensive health packages have been provided. 12 guaranteed packages have been provided to these facilities, and one of the packages providing care to the elderly as well as palliative care. These two aspects are there, which talks about screening the population, how to screen the population. After the screening the population, we do have facility for doing teleconsultation with the specialty services at the district level or any of the assigned medical colleges. After the screening has happened, if the person is referred to a higher center and the treatment continuum is to be there, and the treatment continuum happens at this level. This previously we used to provide only six services from the centers, which was essentially immunization and your RCH services, reproductive child health. Now the gamut has been increased to provide 12 services, including this care for the elderly and the palliative care, as well as screening for the cancer patients. That's one part. Second thing, the wellness aspect, which is there, that the wellness of the people. That means all the centers essentially has to now carry out few of the wellness activities. This is about the rural area. That means do have a structure. We have capacitate our this health workers and providers, because you can't be having doctors everywhere. At this population, doctor is not there. It's a nursing officer or a community health officer. He is providing under the guidance of the medical officer who sits at the primary health center, community health center, or the district hospital. Based on the teleconsultation, whatever is to be provided, that is provided. Second thing, after the release of the senior care guideline, now a comprehensive package of care is being developed for the seniors. Lot of discussions are going on, because cancers alone, suppose you, if you are a surgeon, urologist, you will love to talk about the prostate cancer. But from a policy perspective, for a cancer, all the cancers are equal to us. Sometimes some focus is given on a particular sect of cancer, but essentially screening, capacitating the providers. That means right from the health workers to the medical officers, and providing a continuum of care. That's already there in the policy, as well as it has been implemented. And how quickly we can strengthen the system, that's the work is in progress. And I think we all are working towards that. As more and more awareness is increasing, you will be finding more and more people screened for cancers, and you will be detecting more and more people with cancer and cancer related symptoms, and they will be requiring support accordingly. So that means I am repeating many times, because I want to re-emphasize that policies are in place, structures are being laid out, capacity building efforts have been done and are ongoing, and slowly services are also being strengthened. So in the same area, that in the urban area also, they have been put in place. Second thing, you have talked about the holistic thing. uh, we have, when I was working with Niti Aayog, we have come up with a integrated health policy, and people usually confuse with the integrated health policy. That means you are integrating the modern medicine with the the other pathies. No, it's not that. Integrated means, in the health policy, national health policy, we have talked about patient centric medicines, patient centric treatments. It has to be patient centric. That means the patient is having a choice to choose between any of the systems which he want to for his wellness, and it's all has to be evidence based. That means it's not that if somebody is claiming on an empirical basis, anecdotal basis, that I have done this. No, all the things which a patient is being offered, it has to be evidence based. That should be the bottom line. That means the policy which is now in the process of discussion, that means there also we are talking about the holistic care to the patient. It has to be patient centric. And one way, from the modern medicine side, we are all providing the services. The system is geared to providing and extending the services. Side by side, the patient is also being provided a choice to choose between any of the pathies that is evidence based. I will stop here. I will take on more questions if it is required. Thank you.
Well, thank you, Dr. Gopal. I think the way you defined it and elaborated is totally insightful and informative for the one who are seeking for this. And moving ahead to Dr. Pradeep Garg, I would like you to please discuss that what is the role of patient education in the holistic prostate cancer care approach and how it can be optimized to benefit the patient most. Dr. Pradeep, can you hear me? Dr. Pradeep, can you hear me? I think there must be some network issue. Uh, Moving forward to Dr. Arun, I would like to ask how can
Hello.
healthcare providers better identify and address the psychological impact associated with the prostate cancer diagnosis?
So, as a doctor, as a healthcare provider, so I sit in OPD, I see the patient. First thing is to identify the patient mindset. So, the mindset matters here. It's not the disease going to kill the patient, as I previously emphasized. So, the initial diagnostic shock, how I'm going to handle, what are the emotional response, how I anticipate, how is the eye contact, how is the communication phenomenon, so what's the body language, what is the mindset of the family partners, and what the person per se is facing, how is the impact that will reflect on my therapy. So these are the things I keep in mind. So how I address, so I communicate with the patient, I educate about the disease, I tell these are the stages, or these are the treatment options. So the I will just tell them is the journey matters, not the time duration. So your struggling phase will end soon. So I will give a positive news about the bad thing, what they have, how they are undergoing the events. So I will note it down everything. So I'll support them with my colleagues who may be a mental health provider, or she can be a part-time counselor. Then I educate the partner. So usually we deal with the patient initial diagnosis. So we'll send to the counselor. The counselor will talk about the positive aspects. So then again the patient will come to us. So the timely support and what is the care plan, how I'm going to help them, how is the patient centric approach. That is a tailored plan for him. What is his individual needs? So how I'm going to help him out in difficult situations. So these are the things I keep in mind before um, treating a patient. Moreover, I just openly communicate. So instead of breaking the bad news, I'm going to tell the good events, how it reflects, how this medicine is going to help you. In timeline, what are the problems you'll be facing, how we'll be helping you. So how our team is going to help you. So what's your concern? What is the financial impact? If there is a panel patient, what I'm going to do? If it is a cash patient, what I'm going to do? As a person, the emotional stress matter. It's not about the treatment, it's about the emotion, it's about the psychological impact. And as early as I pick up the things, then the patient also, the burden is eased, the mental pressure, the distress. So any human being, the initial diagnostic shock of cancer, it throws heavy, what to say, the coping mechanism. So how I'm going to deal with the bad news. So everything I will go step by step. I won't put them on the corner place. So you are cornered, you have to do like this, that. These are things I won't speak. I just give the positive aspect of the cancer care. So I'll reflect. So I'm one of you. So you must understand me. These are the core values of the treatment. So this will prolong your life. So this will going to help you in many ways. These are the things, the more focused on the positive aspect rather than the negative impacts of the disease. And regarding the therapy part, so most of the hormonal agents, what are the side effects, everything I'll openly educate. So they will feel at ease. Then I will tell them stories about the previous patient. These are the patient came to me. This thing happened to them. So I'll make an impact to focus on the positive journey with me along with the cancer, without having a temper tantrum or losing interest in the environment. This is how I do the things. The basic thing is educate about the disease, and openly communicate, then get the support from the counselor, then educate the partner and stress management techniques. As simple as that. This is the core values in not only in prostate, in all aspects of the cancer care. So this is how I do things. As a healthcare professional, this is the way the thing should be, what I believe.
Thank you, Dr. Arun, for such insightful information. And you rightly said that the open communication is the key, and this proactive approach to integrating mental health support is really commendable and actually help to going patients a lot. Moving to Dr. Pradeep, what is the role of patient education in the holistic prostate cancer approach, and how it can be optimized to benefit patient the most? Dr. Pradeep, you are on mute. Can you please unmute your mic?
Yes, yes. See, Dr. Raja has rightly said that patient education is very important. When patient comes to us in the OPD, he is in 99.9% times he is in the dark. He doesn't know about the disease, its manifestations, its symptoms, what is going to happen in the future, what is the other things. So patient education is when we educate the patient, we make them the groups. We can have the same type of cancer patient in groups. They can answer their queries. They together can discuss the things. Then these things help in informed decision making for the patient. He may have some treatment options. He may know the potential side effects, outcomes. Then the enhanced understanding of the disease with the help of the counselor, that this is prostate cancer, this is going to happen, what are your stage, how we can monitor the disease, how your anxiety can be reduced about the disease, whether it is not going to progress in the future, it's going to progress. Then the side effects, the what we are going to give, has it got any side effect. आजकल जब patient आता है, he is more concerned about the side effects, that I am going to get chemotherapy, I am going to get hormone therapy, what will be the side effects. So, and last thing, other thing is the healthy lifestyle. We should encourage. Patients sometimes get depressed, they are bedridden, they say their life is going to hamper, maybe in a bad shape after the drugs, after the therapies. So, healthy lifestyle. And then the psychosocial support, which is the most important support, that may come from the same group of cancer patients, that may come from the psychologist in the department, and that may come from the counseling part. So after educating the patient about these things, patient will be we need to develop such things in the department, like multimedia approach, like the YouTube videos, resources. We can help them in a better understanding of the disease. Then this can be through tailored education material. Then the follow-up sessions in the patient. We may incorporate family members and caregivers in the groups. Like here we have what we have started. We are making the cancer groups. We put the same type of cancer patient in the same group. They discuss their problems. They discuss their difficulties. How the life is changing. So they better support each other. So the sport comes from the same groups, and then the technology use, like I have already told, WhatsApp groups, then the collaborations with the teams, because I think cancer is a disease of old age. Patient in the old age have some family problems, some other problems. So ऊपर से disease आ गई. So more of the things going into the patient's brain, कि अभी मैं कैसे टैकल करूंगा, मेरे फाइनेंशियल कहाँ से आएंगे, मेरी और चीजें कहाँ से आएंगी. So all these things can be discussed and better educating the patient. आप patient आपके पास पहली बार आता है, you spend the time with the patient. You spend half an hour, 1 hour, teach him, and also told him that finances कहाँ से आएंगे आपके पास. आयुष्मान भारत है, या अभी और भी बहुत स्कीमें हैं सरकार की जो आपके पास हेल्प कर रही हैं. How they are going to help you, how you can get that, how it is not going to affect you financially, psychosocially, and emotionally. So all things are going to happen. So patient education plays a very important role, very crucial role in geriatric age group, in old age group.
Well, thank you, Dr. Pradeep, for such insights. And I think the multidisciplinary approach that you talked about is really important in the treatment for the patient, not in the cancer, but for every treatment if they are going through. Moving ahead to Dr. Jatinder, I would like to ask, are there any recent research findings that highlight the benefit of integrating physical and psychological therapies in the care of prostate cancer patients?
Ma'am, it is such a new era for research analysis for the perspective of the physical therapy and the complementary aspect in the prostate cancer. Yes, the prospective trials or the old studies has been there where they shows that the physical activity is one of the important factor for the prevention as well as the recurrence of the prostate cancer, and they have a good health life who are having a regular exercise surviving with the prostate cancer. Second, what about the consumption of the foods items? What the research has shown that the consumption of the more milk product can cause the prostate cancer as compared to the other individual products. Diets which are more antioxidant type of like consumption of fruits, vegetables, are the more protective in nature for the prostate cancer rather than the consumption of the milk products. And third, the patient who are doing the regular lifting exercise, because most of the patients are prone to losing of bone mineral density when they are on androgen therapy. So the lifting exercise can help in strengthening the bone. So these prospective studies have shown that yes, there are some impact of the physical and the complementary activities can help in the prostate cancer patient. But individually, no new research are going on. But I have gone through the literature.
Well, thank you, Dr. Jatinder, for such insights. And moving ahead to Dr. K. Madan Gopal, I would like to ask what are the current gaps in insurance coverage for holistic prostate cancer treatments, and how can the policy advocacy efforts to help address these gaps?
This is very, very important because my other fellow panelists, she mentioned that the finances, uh, the part of the finance is because the package rates which are there in the PMJ program. So I think a view has to be taken on that package rates, whether they are viable or whether they are not having any out-of-pocket expenses for the patient or not. That's an important thing because we are very conscious about this and see that how these packages they are extended. One is the surgical part, one is the chemotherapy part, and the radiation. They are covered, but how many number of this? And one of the caveat which has been given in these programs is you should be having a cancer board in the particular health institution which would be guiding that cancer care. They will be deciding how the care approach would be given to that particular cancer patient or not. That's one of the underlying principles which is there. The treatment packages are there, but the other aspect, the psychosocial support and the other things which they are not built in. That the OPD care is because number of visits are required. So OPD care is not the only the inpatient, the surgical correction, the chemotherapy, and that too but up to a particular limit. If the patient, if the hospital proposes a new treatment or the cancer control board in that particular hospital, they propose a new treatment. If it is not covered, then it has to be pre-authorization. But the limit is only in many of the insurance schemes is 5 lakhs unless you have taken a critical care or a cancer treatment. But the cost of the premium is very high. You have to always remember that 80% of the population they earn less than 40,000 rupees. You have to always keep in mind. And a single episode of cancer in a particular person that takes a family back by 10 years, 20 years down the line. That way, financially, they are back by 10, 20 years. We have to always factor this thing, even with a person. And if you look at the retail insurances, it is growing, but only 10%, 15%. And if once it comes to the insurance things, if a person is 60 plus, the insurance premium are very high, which is difficult for many of the people to afford. That's one aspect. That's why the government is has come with a scheme. But how many of the hospitals are empaneled for providing this cancer care, particularly this prostate cancer care? And the look at the packages which have been the uptake of the packages, cancer packages. So that's also calls for a closer review that what is the uptake of the cancer packages, though it's are there, though it's a part of the schemes, but it's not there. So you have to just be very pragmatic in thinking about. Otherwise, in the insurance also, lot of new thoughts and new ideas have to come how to address the issues of the cancer patients. We have provided the treatment options. That means you can get a surgery done, you can get a chemotherapy done, you can get a radiation done. But once it comes to a constant long-term follow-up on a OPD basis, so that's an area where a lot of work is required. And besides that, lot of work is also required how to reduce the premium because most of the clientage they are all seniors, 60 plus, 55 plus. And at that time, the insurance company, the underwriters usually, because the risk of morbidity is very high, the underwriters usually scale up the premium. I just citing my example. I used to pay for 10 lakh insurance around 8,000 rupees. That's a bank insurance, bank policy was there. Now they have hiked it to 30,000 rupees per this 5 times. I have not made a single claim, but no respite. If you want to be covered, then that means that's an option how to reduce the premium cost, how to reduce the cost of the treatment. We should work on that. Otherwise, this financial catastrophe is very, very difficult to avoid. And that's the usually this the fight between this how to reduce the financial catastrophe, how to reduce the premiums, and how to increase the packages. We have to find a viable solution for that. It's still work in progress. We are not to find a we are yet to find a viable solution. Though they will claim it that the insurance करा लो, 80% लोगों के पास पैसा नहीं. And if you look at the senior population, 13% population, around 15 crore population, 70% they live on the remittances given by their family members or their children. And you have to always factor that. And remember, these are the people who require treatment. And they can't afford insurances. It's only the government insurances they are with, and the government insurances do have some limitations. 5 lakh in the PMJ, they are providing 5 lakh. In some other state, they have gone up to 25 lakh rupees. But that's one aspect. Are we honoring that? The providers also have to see that how they work in tandem with the insurances and the government to see that how they provide the best of the care with and make it a win-win situation for everybody. That's the way we have to see how we have to progress in the public health sphere. I'll stop here. Thank you.
Yeah. Very rightly said Dr. Gopal, and I think tackling gaps in insurance coverage is really critical for comprehensive care. And these efforts in advocacy are really essential for improving access to the holistic treatments. Moving ahead to Dr. Pradeep, I would like to discuss what role do the lifestyle modifications such as diets and exercise play in holistic management of prostate cancer, and would there be any dietary recommendations you want to give to the patients and how these can be effectively incorporated?
Yes, lifestyle modifications are going to help and has a significant role in holistic management of the prostate cancer. But changes should be in a stepwise. Like first of all, let us take dietary modifications. We should focus on a balanced diet. Balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Antioxidants are helpful in combating the disease. Then there comes the healthy fats, that is the omega-3 fatty acid, that in fish, flax seeds. Nowadays, flax seeds are in trend, so people are more aware than walnuts. And saturated fat should be reduced. Red processed meat should be reduced. Mutton, people are more favoring towards the taste, so they are eating mutton. Mutton should be discouraged in prostate cancer patient. Then the processed food, that should also be decreased. Sugar intake should be reduced. Refined carbohydrate should be reduced. And the lycopenes, they really help. Lycopenes come in 2003s, but studies start coming. Tomatoes are the rich source of lycopenes. Then the red grapes, watermelon. So they can be inducted in the food. Then the physical activity, that the exercise. Like we start from a 30 minutes walk daily and slowly increasing it to 1 hour or 90 minutes walk per day. that may help in strengthening the muscles because bones are going to be affected in the prostate cancer. So prostate loves the bone. So patient may come to you with the bone metastasis. So exercise will help him improving a muscle strength. So muscle strengthening will help uh, जो वेट bearing joints है उस पे मसल्स का आपका strong होना strengthening will give the impact. Then the weight management, weight should be around uh, total weight height in centimeter minus 100. So it should be the weight like 170 centimeter height, weight should be reduced around 70 kg. It should not be overweight. Then the stress management, yoga. Now we are celebrating yoga. India is the leader in yoga. So let us induct yoga into the treatment part. That will help in reducing the stress. And then the social support, routine checkups, health monitoring, that HB is okay, then the platelets are okay, how the body is responding, are counts getting low, and most important, don't give the burden that you have to do 120-minute exercise daily or you have to do 190-minute exercise. Give small steps. To take small steps, small goals, that you have to achieve 30-minute walk by the 1 month end, and after 2 months go to 45 minutes, then next 1 month you go to 60 minutes. So slowly increase the steps and create a sportive environment. Don't discourage the patient. Don't discourage the question of the patient. Even if patient is asking something about the diet or something, so you must entertain each part. Most of the patients who are alcoholic by all the age, उन्होंने सारी उम्र पिया है और अभी आप आके कहो don't stop the drink. That is the essential part of the disease covering. But you may help him that you may take red wine, about 30 ml red wine. So red wine is full of antioxidants. So you may help in other ways in combating the disease, in making the environment friendly to the patient. So these things are going to help. Diet plays very, very important role. Diet, exercise, yoga, meditations, your religious sentiments. So we need to answer these queries to the patient. Yes.
Well, thank you, Dr. Pradeep. And I think lifestyle modifications can really make a significant impact on the patient's outcome. Moving ahead to Dr. Arun, could you please provide some examples of successful models of integrated care for prostate cancer patients that combine multiple aspects of the support or maybe multidisciplinary approach towards their treatment?
So the integrative care is nothing but a personal model of cancer care. So to avoiding the cancer disparity among the groups, to focus on all the cancer patient as such as a wholesome. Just like addition, multidisciplinary team plus complementary team, alternative medications team. So the to put it in a proper perspective, it's a medical team plus non-medical team. So how we are going to deal with this model? This model has been devised in UK and US. In UK, it's the ICARP model and PIPCAD model in US. So in US, the African American population was being studied. So what they did? So all the patients, they examine the multidisciplinary tumor board. So they take a therapeutic decision regarding the lifestyle modification. What they advise, they ask them to meet with a nutritionist, to do stress reduction techniques, exercise option prescribed by physiotherapist, and supplements and mind body practices. So this will ease the burden of the tumor, burden of the cancer. So they go extra mile, just providing acupressure and acupuncture also, some aromatherapy, exercise, massage, yoga, music therapy. These are the simple as generic integrative model which can be integrated in the cancer care. So in India, the model as per the our education status is a little bit low. Moreover, the Western medicine and the Eastern and Indian medicines, that is a complex interplay between the homeopathic, Ayurvedic, and allopathic medicine. So this kind of disparity exists. But the successful model of two models, one is ICARP model and this PIPCAT model. So nothing but just to integrate the non-medical colleagues with you. Just prescribe them nutritionist, ask them to meet a nutritionist, ask them to meet a psychotherapy, ask them to go to physiotherapy, ask them to go for a yoga sessions. So make the group and pair support. So engage them in activities which will deviate the focus from the cancer care. It means that the cancer treatment will give a pain, and it's a pathetic journey. So in this, you have to focus on the good things. How you focus on good things, like deviating the focus from the toxic effect of the cancer care. So in acupressure or acupuncture or aromatherapy or physiotherapy, what music therapy or mind body practices like yoga or tai chi. So everything will lose the focus from the patient. They will forget about the cancer for a little more time. So this model has been proven, and it has shown better results in order to cope up with the cope up with the treatment part. So these two models exist in the world. So we are in India. We are in nascent stage of integrating these models in our practice. Though we are having all support system. So these things has to be look into it. So if possible, we can offer as a extra complimentary package, or suggest them to get on their own. So it will help them to ease the burden of the cancer. That's all. The aim is to cope up with the cancer. How to lose the focus on the disease itself and focus on the positive aspect of the life. So bringing this kind of a non-medical person in help. So likewise, what I tell, we have many complementary alternative medication practice like homeopathy, Ayurvedic, whatever, then yoga, then oil massage. So these will help him to some extent, but it is not going to cure the disease. We all know that. We are just reducing the burden, pressure on the patient and the patient family to a certain extent. So they will be happy in the cancer journey to certain extents. This is how I look into it. So this is how the model should be in future cancer care. Thank you so
Well,
much.
thank you, Dr. Arun, for such insights. And I think you rightly said that this is really important for the patient to see the positive aspect of everything rather than focusing on why we have got the disease. And I think this whole approach of mind, body, soul that you mentioned is really important in order to do the right treatment. Moving ahead to Dr. Jatinder, I would like to ask, please tell us about in what ways can technology, including telehealth and digital mental health tools, supporting the holistic management of prostate cancer patients.
Holistic approach, as everything has been repeated, ma'am. What about the recurrence? You are asking for me?
I'm
Recurrence of
asking,
the.
in what ways can technology, including telehealth and digital mental health tools, supported the holistic management of prostate cancer patients?
So there's the patient who are residing in the rural area, especially, and as we are recording this webinars, and we can make them learn from this webinar that this webinar can help you in cope up with the prostate cancer, because every individual is giving their expertise for management of the prostate cancer and coping with the complications of the prostate cancer. So teletherapy is one of the important factor where they can get the guidance from the YouTube, from the others method, and we can type the pamphlets and for the prostate cancer and their family also, that they can learn from this telemedications. That's all.
Thank you, Dr. Jitendra, for such insights. Moving ahead to Dr. Madan Gopal, I would like to ask, what are the most promising future developments or innovation in the prostate cancer care, or maybe in the patients who are suffering from cancer that you are anticipating, and what potential impact might they have, and how we can improve training and education for the healthcare professional to enrich that?
Okay, thank you. Because a lot of repetitions are happening. First, what new things are happening is the use of the teleconsultation, because COVID has opened the doors for telemedicine. It has legalized telemedicine consultations, and as a result, a lot of things have evolved. From the government side, also, e-Sanjeevani is there, and we have reached around more than 5 crore consultations till now. So the figure needs to check, but teleconsultations and this the tech aspect which we were mentioning, that's already there. Second thing regarding the cancer care, so we are trying to see that how the district hospital it acts as a hub, as a cancer center where the capacity, that means the district hospitals are linked with the bigger cancer institutions, so that the capacity building of the district hospitals is being done, so that the screening, identification, and treatment initiation can happen near to the patient, so that the cost of traveling, cost of staying in a new city at the tertiary center, that is avoided. So work is in progress in that direction. Also, nowadays, many of the cancer institutions like Tata Memorial, and they are tying up with the different state governments and trying to see that how they can work, create an hub and spoke, and create cancer detection and treatment made available at distant places. That's one thing. Second is side by side capacity building program for the medical officers is happening. We do have Center for Excellence, the AIMS is there, and they have evolved few packages. Packages means modules, online modules. That means, as been mentioned by few of the other panelists, saying that the online modules that are YouTube and everything, these are already portals are there from the government side, which can be accessed by any of the doctors, and they can at least see themselves what are the steps in identification of the cancer as well as in management and the post follow up. Not the treatment and the surgery and other part that won't be there, but that also it's a specialized thing and specialized courses are being offered in that direction also. Second thing is there's a lot of focus on creating infrastructure. As you see that the number of aims from 6 it has risen to 27. That means there is a focus on providing tertiary care facilities near to the person from where he is sailing. Besides that, another important development which is happening is creation of medical college. Though people will argue that that will reduce the caliber, that will reduce the competency of the people, that will dilute the standards. That's one part aspect which can be handled in the later on by building capacity and other things. But nevertheless, the intent is to reach to the people as near as possible. If a medical college providing tertiary care is available in all the districts, you can think that as the incidence of this cancer patients is increasing, at least the care is accessible, affordable, and made in the reach of the people. So that's one thing. Again, capacity building I have already mentioned, and thirdly, we're trying to see that how the medicine which are there, cancer medicine, how to reduce the cost of the cancer medicine. So research is going in that direction. We see that in the coming days we'll be hearing that so many breakthroughs have happened and we have been able to reduce the cost of the treatment. Basically, all leads to reduction in out-of-pocket expenses. That's the only measure which we are having in want to gauge a big program like that. Otherwise, for a provider perspective, say that if a good medicine is available, standard medicine is available, that can be provided to the patient. If a holistic care, he want to develop a holistic care, whatever the other pathies which are there, if they are all evidence based, if there's some empirical evidence for that, we can always suggest that yes, these are the choices. We can always try in that. Technology is there to assist in patient education. You have also mentioned about the patient education. But despite this patient education, as rightly mentioned by my fellow panelists, that means first you talk to the patient, allay his fears, and bring him on the treatment plan. And you can see that if a patient is brought on the treatment plan as advised by the doctors, the quality of life, the quality of response, and the remissions, they are very fast. And the family also, apart from that, we have to go one step further and see that the family or the caregiver, the immediate caregiver, they are also been capacitated in handling this patients and dealing with the mental stress and in dealing. Because if it is only left to the external people, then it's very difficult because the plight of the caregivers is very different because they are the immediate persons who are handling the patient on a 24 by 7 basis. We have to now trying to find out how we develop the capacities for that, and we have identified that area and we are trying to work in that direction how to build capacities of the immediate caregivers. So thank you.
Thank you, Dr. Gopal. And I think these innovation in the holistic cares are really promising. So, in conclusion, our objective for today's panel discussion was to explore and emphasize the importance of holistic prostate cancer care by integrating physical, emotional, and psychological support. And I'm confident that our esteemed panelists have addressed this topic comprehensively and very effectively, presenting the information in a manner that is both thorough and accessible for the one who are seeking for it. I would like to extend my sincere gratitude to each of our panelists for their insightful contribution for this sharing their expertise with us today. Your participation has been very valuable and we deeply appreciate the time and knowledge that you have shared. Thank you so much everyone for joining us today and contributing to this important conversation. Thank you so much.
Thank you so much and much appreciated.